everyone. Can you hear me? Hello, can you hear me?
Yes, we can hear you.
Okay, thank you. Uh, Hello, Ajahn Sivaporn and Ajahn Chakree. Are you ready?
Hello, Dr.Chakree here.
Okay, so good afternoon, everyone. Now, welcome to training on research ethics. We are particularly delighted to have speaker for us. Please join me in extending a warm welcome to Assistant Professor Dr. Sivaporn Sivasinprasasn, a faculty member from the School of Medicine and a valued member of our Human Research Ethics Committee. We are also privileged to introduce another notable member of our Human Research Ethics Committee. Please join me in warmly welcoming Dr. Chakree Wattanasiri from the School of Integrative Medicine. We are delighted to have you join these activities, and we hope that this training will be both informative and inspiring. Please welcome.
Okay, thank you for the lovely introduction, and I would like to give this session to Dr. Chakree first. So please welcome Dr. Chakree.
Okay, so good afternoon, everybody. I have to apologize. My voice might not be clear. I think I'm having like influenza infection or something, but never mind. I think I'll try my best. So, okay, let me share my slides. Okay, sharing. So, okay, I think it's up now. And also I have, I'll put the link to the PDF of my slides into the chat. Let me find that for a while. It's right here. Okay, link to the slides. Prints. Source of ethics human research. Okay, so I think the link is all in the slides right now. Sorry, the link is in the chat right now. So if your friend comes in later, or maybe you can like copy and repost that afterwards. Okay, so let's start off with ethics. So I think ethics is something that people don't want to know much about. It might be a little bit tricky. So let's start with the meaning. I think you have heard the word ethical dilemma. So an ethical dilemma is something where it's very hard for you to make a decision if you go left or if you're going to go right. So both of them seems right, and we are not quite sure which one is the best. So there's a process of finding the best way or the best ethical decision to be made. So that also happens in research. Sorry, I didn't hear. Was there a question maybe? No? Okay. Okay. So let's look at an example of a research question. Sometimes it might be also might be with some dilemma. Okay. Okay, my computer just generated some subtitles. Okay, I hope the internet is good. So let's see if you are a researcher and you work in maybe relationship, organization, and you want to know what behaviors of your superiors, like your boss, that can contribute for you having depression. And you also not want to know how effective or how dangerous those behaviors are. So this is quite a dilemma because is it a good research? Maybe yes, you might be able to like improve the workspace situation stuff. But if you are studying your boss, that might be not quite good. Yes, your boss might like hate you, she might fire you, something like that. So it's a big dilemma. How do you do that? Do you go ask your boss directly, like what behaviors do you like to do? Or do you ask other subordinates, like other people, like what did you experience? Do you interview them? Do you record that interview? And even after the research is out, what is the aftermath? So if you publish your research, like, okay, the behavior of the boss, 1, 2, 3, 4, 5, and 1, 2, 3 sort of like contributes to depression somehow with your analysis. So it's a very big deal. There's ethic issues in the study and also ethic issues after the study. So this is why we need to understand these principles to be able to conduct human research at the very best. Okay. So this is the outline of what I'm going to talk with you guys today. So I'm going to show you some of the histories because most of the time we learn from the past. Like we learn from the errors. It's like trial and error. And we build up on that and make guidelines that we have in the present. So these are all the things that we, actually there's like many of them, but I just picked some of them that I think is of your interest. Okay. So first of all, 1920. This one is related to psychology and a little bit of medicine. So this research is called the Little Albert Experiment by Watson and Rayner. So what he did is that back in the past, psychologists thought that we can condition people. Condition means we can change how they feel, change how they respond. So they start like this. They borrowed a baby, like just very simple. They go to the lab technician and like, hi, I'm your boss. Can I have your baby? Technician is like, okay, you're my boss, take my baby. So when the baby's here, babies are newborn. They are not afraid of anything. So they put a white rat in front of them. Nothing happens. But then if they put the baby in front of a large sound, like a metal bar, and they like hit it, the baby gets scared and cries. So these are two situations. The normal rat, no fear. Loud noise, fear. So they put these two together. They put the rat there. They put the loud noise there. So the baby starts crying. And the baby sort of like gets conditioned. Whenever they see these two, or maybe just one of them, they can get fear. So after that, only putting the rat in front of the baby and the baby becomes fear and done. They get the Nobel Prize, they get the papers, they get the PhD and everything. But what happens to the baby? Is the baby the same? At first, the baby is not afraid of rats. But after the experiment, the baby is now afraid of rats. So this is not acceptable in terms of ethics because your participant inside that study is not as normal as before. There's some damage going on. There's some risk going on. We call these types psychological risks. Okay, so moving on. A little bit further into 1933. So back then, there was the World War II, and there was the concentration camp. So this concentration camp was in Nuremberg back then. In those camps, they had their war prisoners, like 10,000 of them. And the winning side back then, they thought that, okay, these people are prisoners. We will execute them someday anyway. So we might have just used them for other purpose because they're going to die anyway. So that was their thinking back then. So they made all types of experiments. And the most scariest thing is that people who conduct the experiments are even doctors. They did like twin experiments. So they have twins here and they sort of like put some electric current in the brain of one twin and see if the other twin can sense that, something like that, to see the connection between the twin. They did some transplantation, bone muscle nerves, like people who have like lost muscle, they take muscle out and put it in that person, see how it goes. Freezing experiment, they want to know how long a person can survive in the snow because that information will be good for military. So they just throw these prisoners out in the snow and just leave them there. And the scientists just like count like, okay, day 1, okay, day 2, okay, day 10, no response, and day 15 die, something like that. And they have all these numbers and make an average. So there's lots and lots of things. Seawater experiment is like letting them drink seawater to see how long they can stay in the sea. So this is very horrific and very scary. If you look at this video later, you can try to see. In this picture, these are like the housings, and these here are the human remains. So after all experiments, they just like dig a big hole and just put them in, done. So that is like one of the very bad part in human history. But it was not left untouched. So after that, the winning side, the winning side at the end, they all came together and they made a trial against the Nazi Germany. So all the allies, US, UK, Soviet Union, and they had this big trial called the Nuremberg trial. So they had to translate it into like many language because they need like lots of lawyers to make that tribunal, and they sort of like made the decisions, like what crime did, crime against peace, crimes against humanity and stuff. So after that was done in 1946, 12 were sentenced to death. In that also include doctors. 3 had to go to prison. 4 had prison, but like not a lifetime. And even some of them were executed, like in public, for people to see that, okay, we don't take this crime like lightly. So that was like one of the biggest wake-up call, that even if these are prisoners, they're still human. You cannot experiment on them without any empathy like that. So from this event, it was changed into the Nuremberg Code. So we have this code, sorry, we have this code as a guideline. So it lists 10 principles, for example, voluntary informed consent, avoidance of physical and mental injury. The degree of risk should not exceed the benefit, because if you do research and there's no benefit, why would you do that? It does not make anything good out of that. Research has to be performed by scientifically qualified people. Participants can freely end the experiment. You cannot sort of like control them for the whole time, because they're not prisoners. They're participants. They're people like us. And also experiments must be stopped if it's too dangerous. Sometimes we don't know what our experiments is going to cause, but if it's too dangerous, you have to stop that. You cannot do it to the final end. Okay. So moving on, not sort of like moving on, moving back a little bit. So this one is in the United States in 1932. It's called the Tuskegee experiment. Okay, so in this experiment, back then, they had slaves, and those were people of color. So most of them are like Black people. And back then, when they were receiving their citizenship, they only received some part of welfare. So the government came in to the Tuskegee area, and they said that we're going to provide special treatment, special welfare for you guys. We'll have police to stand on guard and assist. We'll have a nurse, mostly like women nurse, nice, look pretty. And what they do is that they recruit all these Black men and they draw out some of their blood. That's all. So this is also the doctor who was the head of that research. At first, people thought it was a welfare program, but actually, it was a research that is issued by the Public Health Service of US. So back at that time, syphilis was a very big problem, and also a big problem in white people and Black people. And what they want to do is that they want to study, they want to observe how syphilis develops or becomes severe or transmit or somehow stops, like naturally. So that's what they were doing. There was no consent collected. They did not tell that this is a research. People in there, 399, they had syphilis. 201 did not have syphilis. And the only thing is that they took out the blood. So they say that, oh, sorry. They say that these are bad blood. So if the doctors take out these blood, somehow their system, their body will be less of bad things and they'll be more healthier, something like that. So most of the time, that's only the thing that they do. They come in, take out the blood, and they go away. But they also provide like some free medical exams, free food, some free insurance. So this is like a summarize of the timeline. Sorry. Okay, my throat is so acting up. So in 1932, that is the start of the study. It's called Tuskegee Study of Untreated Syphilis in Negro Male, but this was not shown to public. In 1936, some physicians said that, okay, they were told like not to treat them, only observe them until they die. In 1945, there was a medicine called penicillin, which was approved. And penicillin can also treat syphilis. But at that time, the participants, they are like people of color. They did not have access to modern medicine, not access to like treatment that are expensive. So they did not receive penicillin. They did not even know that penicillin was available. And after that, for about another 20 years, that's a very long time, the head of the project, Peter Buxton, the guy in the picture before, started to get some complaints, some ethical issue complaints. So in 1972, the study ends, and the public was very mad because if you know that penicillin was available, then syphilis is not a problem anymore. That means the study had to stop in this period of time. But why did the head of project continued for another 20 years? That's almost a lifetime of a teenager. So the Congress filed a lawsuit against the research team on behalf of the people. And in 1974, they reached a settlement, 10 million US dollars, and they had to like provide lifetime health benefit programs for everyone inside that study. So yeah, 1997. So this was one of the first and one of the few situations where the president of the United States had to come out and apologize to his people. So he's like, okay, we did wrong. Some of our scientists were bad. Studies should have stopped like 30 years ago. And he just had like, okay, sorry, we'll take care of you. But if you look at the effect of everything, if the men who had syphilis were not treated and they understand that that they were being treated, and if they go back and sort of like sleep with their wives and everything, they can still infect other people. So that form of omitting those information can also cause damage to other people around the participants. So this is another big issue for ethics. Okay, so from this study and many others, there was something called the Belmont Report. Oh. So the Belmont Report has 3 parts. Part 1, they say respect for person. So every single people is a person. I'm a person, you are a person. We should have the same rights. If you remember in the Nuremberg trial, people who are prisoners, people say, some of those soldiers said that they're gonna die anyway, so maybe we can study them. But that's not okay because they're still people. So they do not have lower autonomy like us. They also are entitled to protection as you and as me. So that's the first part. The second part of the Belmont said that you need beneficence. Beneficence mean because in everything that we do, there's the risk and there's the benefit. It's like on a scale that we have to weigh out. So everything that we do, we have to ensure that there is benefit. Research has to produce something good. There has to be some benefit coming out of that. So if there's harm going on in your study, you must be able to protect them from that harm, or you have to make some effort to secure that they have the good well-being. For example, if you do some studies on drugs, like I'm a pharmacist, sometimes we develop new drugs and we give them to patients. We don't know the side effects at the moment, but we make effort. We say that if something goes bad, you can go to the hospital and get yourself treated for those side effects, and research team will take care of all the medical costs, something like that. Okay, and the final part is justice. So justice is that we must be able to see the difference in each individual. We are all human. Some are children, some are normal, adult, old people, patients. So everybody has their own different situation. But when you provide treatment, you have to do it like equally. If you look at the Tuskegee case, Black people, they were not treated. That's not good. So we need to know what they need. They need to have like equal share. You have to account for all of their individual needs, societal contribution, and merit. So you have to look in a broader view to confirm that everybody is equal or equity. So these three components, they sort of like interact all the time. And these are the main cores that the ethical committee will look into your protocol or your research every time you submit them. Okay, so I included this picture because in the Thai language, equality, we say ความเท่าเทียม but equity, we don't have a word for that. Equality means you give something equal to everyone. But does everybody need that? Like this guy is like very tall. Without a chair, he can see the game over the fence. But equity means that you give it according to their need, but they have the same outcome. Most of the time, as children, in research, we need to do extra protection more than adults for them to like see the game and also secure their well-being. So this is one of the situation you need to like keep in mind. Oh my God. My voice is getting really bad. Just one moment. Okay. Okay. So I think I talk about two examples which are in the medical fields. So there's a couple more examples more in the social science field. I don't know the major background of all the participants. I think they're like some mix of like medical and social science. So, but I think it's nevertheless, it's quite good that you can like experience both aspects to see the ethical issues in there. So this one is called the Tea Room Trade Study in 1960s. So back then, the problem is that in the United States, policemen were arresting people who were committing sexual acts in restrooms, and most of them were homosexuals. So back at that time, it was very like a stigma, not quite accepted by society. So there was this guy, Humphrey, this guy over here. He was a social science PhD student at Washington University. He said that he wants to study this issue. He wants to find the motive and reason why these men are still going to this public restroom, although they know they can get caught. So he just wants to understand. And if he understands that, he might try to find a new solution. Because he said that this is so important. It's a problem going on. People are still doing it, and police are still arresting. So there has to be something that we can learn from here. So what he did is that he designed a study. It was going to be participant observation and also structured interview. So those public restroom, we call it tea room. He stationed himself there in front of those tea rooms, and he said that he's going to be a watch queen. So the watch queen is someone who like stays outside. If police come, he gives a signal to people inside that, okay, police are coming. You should stop and get out, something like that. So he was a watch queen for like many cases. And then he sort of like gained trust. Like when you go into a community, you need to sort of like help them, blend in with them for a certain period of time to gain their trust, and then you can conduct your research, collect your data. He did not say he was a scientist, but then he started his research anyway. And he sort of like tell them like, okay, can you just tell me like why you keep doing this? Although, you know, it's like dangerous and stuff. So what he found is that most of the men who were going to these tea rooms, they were quite better educated people. So they were like university professors, government officers, like lots of stuff. And also to avoid any bias during that interview in the tea room and the restroom, Humphrey also said that he followed these participants. He did not tell them that he's a scientist. He noted down their like license plates on their cars, and he went to their house. Sometimes he disguised. This one is AI generated, not quite good. I don't think he looks like this, but maybe something of this sort. He disguised as a health service interviewer, and then he went there to collect like even more data, because some of those people did not like truly say what their jobs were because they might be embarrassed of their jobs. So the results. From his finding, he said that 44% of the male that went to the tea room were married, and they have wives, and they were exemplary citizens. So they were like very high rank. Some of them were judges, attorneys, school teachers, university professors, like lots of them. 38% were heterosexuals, but they had marriage tension. Most were Catholic. So because lots of these tension, they want to find something quick, some very quick and easy sexual gratification to sort of like reduce their stress. 24 was bisexual, 24 was single and homosexual, and 14 was like openly homosexual. So the problem is that they were not entirely homosexual. They were also heterosexual people in this case. So from his research, he went to the police department and he persuaded them like, okay, those acts of tea room trade, they were not crime. They were sort of like something in consent in those people. So the police department sort of like revised their law and reduced the condition of those arrests. And eventually the arrests were like going way down. And that was a big social benefit from his work. But back then, his university did not have an IRB. That's an institutional review board. It's a type of ethic committee. There was only the dissertation proposal reviewed by the PhD committee. So after that, the law was changed. The study was published, and lots of university professors came out. And they say that this research is unethical because Humphrey somehow invaded the privacy of these people. And also some of the information, well, I'm not quite sure about the entire story. They say that there was some leak of information and that damaged the social status of lots of the participants, mostly some judges. So there was a petition going on to rescind his PhD degree, and faculty members were starting to like fight each other. So it was like a very big deal. Okay. Yeah. So that was one type of social science study. Was there something good? Was there benefit out of that? Yes. Humphrey sort of like helped lots of people, but were there some risk? Well, because it was quite long ago, information was not quite clear, but there was some people saying there was some breach of confidentiality, and that causes some damage to some people who had like high jobs in the society. Okay. So moving forward, we thought that these social experiments will be better, will be more secure in 2008. So that was like almost 20 years ago. This was called the T3 study. Taste, ties, and time. So the paper is quite blur because you cannot find it anymore. It was the best picture that I could find off the internet from this website. So in this study, there was a researchers, they call themselves the T3. What they did is that they opened lots and lots of Facebook and they collected these data. They wanted to make a giant data set with like thousands of people. So they say that they took this data set from university students, the class of 2006, from a diverse private college. So what did they take? They take about their friendship, their like networking, cultural tastes, academic majors, race, like Asian, white, black, and stuff, where they live, where they go, and they sort of like to trying to map these social networks. And they also want to know how these social networks originate and how they evolve. And they sort of like made this huge data set with like thousands of entries, and they made it public. But before they made that public, they tried to protect the privacy. They did not put in the name, no last name, no ID or anything, and they just put it out in a research style. But unfortunately, and I think you all know, in the age of like internet, people are quite good at being detectives online. So in a matter of days, I think it was only 3 days, some professors in another university, they deduced all the information because they knew the major, the area that they live, and they pinpoint that, okay, I know this information came from Harvard. So when that came out, lots of people confirmed the same finding. And people in Harvard were like very, very angry. Like, why was my information included in this data set? I did not approve that. I did not give consent. So the T3 researchers were accused failure to adhere to ethical research standards because they did not ask for consent from these people. Sometimes they argue that because you put things on Facebook, it's already public, right? So you sort of like consent somehow. But in terms of ethics, please remember, during research and also after research, there is something going on after research when they propose those like networks and stuff. People were very angry about that. So everything was also reviewed by the IRB at that time, but nevertheless, it is sort of like was breaching some of their student privacy because they were supposed to make it private, but people found out anyway who they were. So that means the methodology or process of making that unidentifiable is still not good enough. So eventually the research was taken down, retracted, the paper gone, dataset was also gone from the internet. And the only thing we have left was that screenshot that I showed earlier. Okay. Another study. This one was from Facebook again. So it's called the Emotion Contagion Study. So the thing from this study is that in the age of social media, we see people a lot. We see other people a lot in social media. Sometimes we see people who are like successful. They got better grades than us. They went to some movies that we did not have the opportunity to go. So there were lots of stressful emotions going on in social media. Some people were like going to ban social media for certain age people, like children, because they are afraid of these negative effects. So somehow Facebook reached out to some psychologists and did the emotional contagion study. So what they did is like this. They included 700,000 people. That's a very big one for 1 week. And they want to see how their emotions are impacted by what they interact online. So there are two groups. Oh, sorry, two controls. Okay, 4 groups. The first group is called negativity reduce. So in these people, in their news feeds, they will see less of the negative words. They will not see the word like sad, the word bad, the negative ones for 1 week. Second group is called the positive reduce. So they will not see the word happy, joyful, enjoy, glad, and those stuff. They will be blocked for like 1 week. And there were 2 control groups, one for this and one for this, to do the comparison. So those were a lot of people in sort of like hundreds of thousands. And I think you might be able to guess the results. Researchers found that people in the positivity reduced group, they tend to use fewer positive words because in that 1 week, they see sort of like lots of negative words. So they don't have the encouragement to use positive ones. And people in the negative reduce group, they use slightly more positive words because they see more good words, something like that. So they say that, okay, we found evidence of emotional contagion. Your environment can affect your emotion, like a disease, like a contagion, because they did it in like 100,000 people scale. So again, this paper was published, people were like, yay, we knew something about social media. If social media show good words, people be happy. If social media show bad words, people be depressed. And again, the public was not happy. Number one, quite the same. The participant did not know that they were in a study because they argue that Facebook sort of like deliberately changed their experience by reducing some of those words, and people did not consent to that. So in the group who had reduced negative, people can say, yeah, that's a benefit. You make a good environment for them. But what about the group who had less positive? They're in a more negative environment. That can be a risk somehow. If those people have some mental condition, maybe those increased negativity might cause, I don't know, some effects on their condition. And again, the study did not undergo any ethical reviews. So I think the study was published and I think it's still online somewhere, but the editors also had to express some concern. Like, okay, we know that there was not any reviews, but nevertheless, it gives some good insight to the society. And somehow, any consequence that happens, it's on the researchers, not the editors, like that. So yeah, this is another example. So the most recent one, go back to medical, 2020, when COVID-19 was sort of like on the rise. So back then, if you remember, like a couple of years ago, humankind was sort of like going to extinct somehow. We were all gonna die. And there was some vaccines coming out. We did not know how will it work or not. So some of the scientists said they want to do SHIMS. So SHIMS is called, it stands for Controlled Human Infection Models. So they propose that take a healthy person, spray them with the COVID-19 virus, like through nasal spray, and see how the infection develops. If anything happens, they will try to treat and rescue at the best that they can. So this was done in like the high cutting edge research facility, the top hospitals in UK and stuff. So this was also a ethical dilemma back then. The dilemma is, number one, people are dying. We don't know how to handle COVID-19 because it's dangerous. Dilemma number two, but if we see how COVID-19 starts from like day 0 to day 100, we might, and I emphasize, we might know how to treat it. So if you're gonna put a virus onto a healthy person, if you cannot rescue him or her, you might be killing them, right? So it's a very big dilemma back then. But eventually, due to the urgency of everything and stuff, the benefit somehow was a little bit higher than the risk. And those ethical committees, it was done by the WHO, they approved that, but they had like tons and tons of regulations. The hospital has to have like extra beds, extra defibrillators, ventilators, everything to rescue these people on time. And it was conducted and completed. Okay. Okay. So I think I'm using quite a lot of time for 40 minutes now. So before I sign off, I think everybody sort of like sees how this goes. You might hear lots of words that I say, the words that are concerned in ethics. Informed consent, ICF, it's like informed consent form, yeah. Risk and benefit, minimizing the risk, like confidentiality. Vulnerability, so some people are not as strong as normal people. Like me right now, like I'm very sick, my neck is broken, so I'm quite vulnerable. And if a study says like, okay, we're gonna treat your throat condition, and I have that condition, I might like, okay, yes, say yes without thinking anything. Or people who are old, sometimes they have mental problems, they cannot remember well. Going into some studies might be a harm to them, something like that. So yeah, but the bottom line of everything in research ethics, it goes back to the saying by Hippocrates quite a long time ago. First, do no harm. So any research that you do, make sure that you don't do harm. You have to produce benefit. You have to make something good for the human society. Yeah. Okay. So I think that is like the first part of my talk. Before I move on to my interactive activity, is there any questions or any parts that I speak too fast or was coughing too much? I saw someone put like US up here. I don't know, were you doing some note maybe? Was that a question or not? Okay. So if you're having a question, take your time. I'm going to change my slides into the next one. Okay. Yeah. So as you all know, teaching online is like this. I'm just talking to myself at home with my cats, and people are looking at me through the camera, but never mind. So now I'm going to get some interactions from you guys. So in this part, I selected some case studies. They are based on actual real ones, but I changed them a little bit. So you don't see, it's not like a total copy from them. Okay. Oh no. Okay. Yeah, here we go. So now you know the principles, risk, benefit, consent, and stuff. I want you guys to be the ethics committee, because inside the ethics committee, there are a group of people from many backgrounds. Like I'm a pharmacist, School of Integrative Medicine. Dr. Sivaporn is a physical therapist. She's from School of Medicine. We have people from nursing, people from social science. We have everybody. So let's see how we get to our decision together. Okay, case number 1. So this case, I named then Let's Dance. Woohoo, let's dance. So it's a research by a physical therapy student. I use short words lots of times, sorry. So this student says he wants to see the effect of Zumba dancing like this on the leg muscle strength. So does Zumba dance make your leg muscle stronger? Something like that. So his method is that, okay, people come in, they go to the Zumba dancing class 4 times, day 1, 7, 14, and 28. And every day after they dance, the researcher will measure the muscle strength. So he said that, okay, research will pay incentive, like compensation, like thank you for attending on the day 28 for a price of 400 bahts. Okay, issue. So only the volunteers who participate in all 4 visits, who dance on day 1, 7, 14, 28, will receive the incentive. So from this issue, do you think it is appropriate or not? Okay, I have a voting system for you guys. Oh my God, it's not coming up. Okay, you can think on that. You have your papers. Let me, because I changed my computer, maybe I have to install this first. Okay, give me 3 minutes. I was doing it last night and it was okay. That, this. Okay, logging in. Authorizing. Okay, is it coming? I'm also excited too. Yay, it's coming. Okay, okay. So here what you're gonna do. You know the prompt, like is it appropriate or not? And you can either use your mobile phone. In case you're using your computer or laptop, you can use your mobile phone and you like scan that or go to slido.com, enter that, and then you can vote. So the issue was that only the participants who can enter the study from like day 1, 7, 14, 28 would receive the incentive. If you think that's appropriate, you can say like, okay, 100%, I'm fine with that. Or if you're like, maybe 50% or 50% inappropriate, or like, I don't know, my head hurts right now. Okay, let me see how many participants we have. Oh, okay, we have like 87. Okay, lots of people. Okay, lots and lots of people. Okay, I think I'll do like the average rule. We have 80, so I'll wait until like 40 people answer. We have 39 right now. One more? 42. Okay. So okay. So what we see here is that 50% appropriate. Most of you guys say that it's not entirely appropriate, and only 50% of this study is appropriate. Okay, let's see why. Okay. So the reasoning is something like this. Participants have to be with you 28 days, right? But what if they cannot be there? Let's say their family members get ill, they might need to like move to another province, like very emergency immediately. If they cannot stay for the whole time, they don't get the incentive. That might be deprivation. Oh, and my subtitle is gone. Sorry. Subtitle. Okay. So we also have to keep in mind, because if you remember from the Nuremberg Code, participants are freely to end the experiment at any time, and you should not cut away their benefit. Or in some cases, research team might be like crazy. People might feel uncomfortable with research team. Maybe research team become crazy, or research team has like different schedule, they cannot comply anymore. So normally, if I can go back up there. Yeah. So it's actually 4 visits, right? Day 1, 7, 14, 28. And it's 400 bahts. Why not change into 100 bahts each time? So 100 day 1, 100 day 7, 100 day 14, and 100 day 28. So if they cannot come to day 28, they can still get like 300. And that's better than not getting anything at all. Okay, so I think you sort of like see some issues that the ethics committees will be concerned of. Okay. Okay, so moving on. The second one, it's called Granny, You Better Work. So in this case, researchers want to study in elder volunteers because, as you know, Thailand is going into like a elderly population somehow. We have lots of old people. And they have a special oil. They call it horse oil. I don't know if it's from a horse or not. And they say this oil can recover muscle soreness because older people, their muscle are not as strong as us. They walk a little bit, they get sore. So they need something to help them recover from that. Sounds good. So method is that they take 30 elder volunteers, come in, and they let them walk for 400 meters to make their leg muscles exhaust. Or if they can walk more, they say, keep walking. Walk until your legs become sore. And then they apply the horse oil to the leg muscle, and they will measure the recovery. That's all. Compensation, the researcher will pay for all medical fees in case of RRI. It's called research-related injuries. Okay. So yeah, we want to know if that can help. So we get people to like get sore. So do you think that forcing these people to walk until muscle exhaustion is appropriate or not? Okay. Again, let's try to vote again. So if the volunteer is like this, that might not be a problem. She's very active, doesn't get sore from dancing. I'm not sure you can use like the same code, maybe. Okay, some answers coming in. Okay, not okay. 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 The majority is like not happy. I'm not happy with this case. Okay, while waiting. Okay. Okay, while I'm waiting for some of the answer, I saw something in the chat, okay, from Anmar Khan. Apologies, I have not been correctly reading your name. How can we weigh the benefit of a research to the ethical concerns? Because some research may be unethical but very important, like the COVID research. Okay, I will keep that in mind and I'll answer at the end. Okay. So from this protocol prompt, lots of people, more than half, said that not okay. I'm going to reject this research. I'm not going to let them pass. You will never graduate. Okay, let's see. Okay. So in this case, there's a major concern, right? Although we say that we are in an aging society, lots of old people, and oh, sorry. My cursor is leaving me. Okay. So elder patients, they are frail and they have higher risk of falling. Frail means like their bones can break easy if something goes wrong. So we know that there's some risk going on. But if we say that we're not gonna let you do this at all, sometimes that may be too harsh, because elder people, they walk every day, right? 400 meters, that might even be less than what they walk every day. But we know that they can fall, that it might be some risk. Maybe we can minimize that risk. Number one, can we scope down to a low risk subgroup? Let's say there are some elders who like can go hiking. They might be stronger than us. Maybe we do it on this group. They are less likely to fall. Or we can provide walking assistance, like a walker, a cane, that might help. Walking shoes, we can secure the floor, make it soft, make it flat, or maybe we can find other methods for measuring leg pain from walking. So actually, this research was okay, but there were lots of adjustments at the end. So at first it might sound not okay, but if you know the issue, you know how to overcome that, it can be turned into something good afterwards. So this is like an example of vulnerable groups, like elder people, frail and high risks of falling and stuff. So these are basically physical risk that we see. Okay, let's go on. Case number 3. Okay, girly talk. So in this case, the researcher, still in the medical field, they want to know the correlation of a physical activity and the sleeping quality of menopause women. Because we have lots of women in the society, and once they enter menopause, like right now, menopause starts at like 45 or something, they have sleeping problems, and that can affect work, life, mental, everything. They want to find a solution for that. So they recruited 15 volunteers, and they want to make a group interview. They use a question from a certified questionnaire called the MEN QOL and GPAC. So MEN QOL is menopause specific quality of life, and GPAC is global physical activity questionnaire. There are, I think there's like 20 questions in here and 10 here, but some of the question goes like this. How often do you experience dry skin? Okay, sounds like, okay, I can answer that. Do you experience vaginal dryness during intercourse? I might not want to answer that in public, right? So there are these type of questions, and they want to do a group interview. In this case, do you think that these questions are appropriate to ask in a group interview setting? So, okay, let's try to vote again. So a group interview is like you have a room and all 15 participants like sit together in that room, and researchers in the middle and like ask the question, and they go one by one by one. So group interview is quite good actually. If you go learn in your methodology, it sort of like helps engagement. People who do not talk well, no, people who are quite shy, a little bit afraid, need some encouragement. Group interviews can sort of like encourage that, make that more interactive. But there's also a downside. Everybody will hear you. Everybody will hear your answer. Okay. Okay. So again, more than half, you guys feel like, no, this is not okay. I cannot answer that question in a public setting. Okay. 44% now. That's quite a lot. Okay. And where is my cursor again? Okay. Yeah. So the issue there is like this. This is a psychological risk that is often overlooked because we know that group interviews are like very good. Like in this picture, you can get lots of engagement. Some people might forget something, but when they are in a big group, they suddenly like, oh yeah, me too. I remember too. And my story is like this, 1, 2, 3. But the thing is, the privacy and confidentiality in a group interview is very, very low, sometimes lost, and that can be a problem. And if you change the setting of this research into a single interview, that might be better, right? Because no secrets is being breached, no privacy is being lost or anything. But we also have to concern about where you're doing that interview. Some people say, I'm just going to talk to them on a coffee shop next to a busy road like this. Well, maybe that's not quite good. Although you're just like two, other people don't know you, but it's a public space. So there are many contexts, many factors that affect the privacy and confidentiality in these cases. Okay. So I think I have one more case, right? Yeah. I try to make 2 medical and try to make 2 social because I'm not quite expert in social science. Okay, this one. So from the ethical dilemma that we had at the start of my talk, let's say we put it into a research. How toxic is my boss? So researcher, they want to study the type of toxic behavior of a boss type people. And they want to know the magnitude of those behaviors that can cause depression in their subordinates. So researchers said they're going to interview 30 subordinates, and they are going to collect these so-called toxic behavior, and then they will request the health records of these people. Like, do you have mental problem, some depression, bad, like severe depression, something like that. And then they will go and interview the superiors because they want to confirm the finding. But they say that, yeah, we saw that in the old times, we have to disguise. So it's a deception. So the superiors will be told that this interview is about organizational management. They would not say directly that they want to confirm what the subordinates say. So they go into interview with them with a different image. So the issue is like this. Do you think this deception approach is ethically appropriate in this case? Okay. It's more like psychology. So this is a sample of a boss, like if the boss does this, is this toxic or not? Can this cause depression in you? Nobody knows. Some people say like depression is a very big deal. We need to get to the source of this problem somehow. Okay, lots of people say like, no, not appropriate. Some say like it's 50% appropriate. Someone said like my head hurts. The protocols are getting more and more weird. Okay. Well, I think it's good that most of you can detect something wrong in the protocols in the case. Okay, we at 43, like halfway. Okay, so again, the majority said, no, this is not okay. You cannot do that. Okay, so actually there are many issues with this one. But one thing that I want to raise is that many of these topics, they can be very interesting and they can be promising because like these problems, they are a real problem. And if we can find a solution to that, that's okay. But in some cases, we have to look at, is it scientifically sound, right? So when they say scientifically sound, we need to look at all the factors. Like, should we be doing it? Does it answer a scientific question? So most of the time we look at the input and we look at the output. So in this case, you're trying to say the boss toxic behavior link to the subordinate depression. But whenever we have some research that involves like mental health, we will also invite a psychiatrist, like the doctors who treat depression people. And most of the time they say like the factors that affect depression might not only be the boss. There might be some issues from friends, issues from family, issues from, I don't know, food, genetics. There's like lots and lots of issues. So maybe this type of correlation might not be scientifically sound at the moment. You can change it into some other aspects. Let's say like the attentiveness of the subordinates to these behavior, something like that, but maybe not a medical condition. And lots of these situations might have been done before, maybe. You might have already known some of the toxic behaviors. A list may be provided into like some previous studies. And also if you do deception, many of the time, if you do deception at the end of a study, you need to reveal the truth. We call it debriefing. So if you reveal that to the boss, what will happen? The boss might be even more toxic to the subordinates. So it's a very big issue. So in these types of situations, if we see something like this, we might recommend, can you do some adjustments on your methodology? Let's say if you make it into maybe an unidentifiable survey, something like that, or your questions can be like less subjective. Because if you like target the boss directly, some people who like hate the boss from other reasons might be very, very hateful. Maybe make it towards like an organization in overall or something like that. Or sometimes these situations sounds like an HR thing, right? Because HR, they do evaluation every 6 months, I think. There has to be some feedback going on in there. If you can request those feedbacks and you can analyze somehow without breaching any confidentiality, we call it looking into secondary data like this, that can also provide similar output or outcome, maybe. Yeah, so these are the 4 main case studies that I prepared for you guys. Okay. So before I sign off from my session, okay, I think I should answer the question in the chat. Okay, so the question from Ant, how can we weigh the benefit of a research to the ethical concerns? Because some research may be unethical, but very important, like the COVID research. Okay, so how should I answer this? So ethics in research is not definite. It's not exactly the same all the time. If you want to do the shim study, I think I should like open, oh no. No. Let me open back the shim slides. This one. Okay, so back then that was 2022. So if you do shim back there was no cure. We had no idea what was going on. Humans were all gonna die. So we need to do something. If you can assure that you infect that person, but you are able to like rescue them if something happens, and the committee sees that, okay, we can rescue them, there's some harm going on, but you can minimize and control that, that'll be okay. But nowadays, we have vaccines. There are vaccines that also work, even people don't like them. You want to do the COVID research today in 2024. That will not be accepted. Like you want to infect people with COVID. You cannot do that because if we have a standard treatment already and you want to like infect people and test something on them, that will, it's too much harm for this setting at the moment. We would recommend that if you want to do COVID research in the present, 2024, maybe you go to the hospital at the infectious clinic and you might wait there when a COVID patient comes in because they got COVID like naturally. They have their medication, they have the standard treatment, and you might sort of like do your study on them that does not take away the standard treatment. That'll be okay. So those are the risks and benefits that we sort of like measure all the time. Okay, not sure that that answered your question. Or maybe Ajahn Sivaporn, if you want to add anything on the COVID research.
I think that for the COVID research was the hot issue during
Yes.
last couple of years, and in the first part of COVID-19 era, the first thing that I think that the compensation for the participant during that era is very high. I think that I'm not sure, but I heard that the compensation for the participant who get the COVID virus maybe about 200,000 baht, Thai baht for participant. So in that time, we don't know about the harm or the risk that may arise from the research. So I think that what the researcher can do is to indicate the withdrawal criteria and also early terminate criteria that may useful to manage the research project that may have a lot of risk to the participant.
Yeah, I also agree on that because like Ajahn Sivaporn said, the incentive for the shim participants were like very high, almost like $10,000 somehow, and they also have like lots of health insurance and stuff too. So yeah, back then it was very expensive and very tricky to do that.
Yes, and I think that as Dr. Chakree mentioned before, if there is the potential risk, the researcher must demonstrate the strategy to minimize the risk.
Mhm. Yes, have to clearly identify and show that if that risk happens, because in experiment it can happen all the time, researchers must be able to like control that, minimize that, not to cause any permanent damage on the participants. So another question from Chin. Can you more explain about people with diminished autonomy? Okay. So autonomy means they have the capacity to make a decision. So they understand and they have freedom to decide to say yes or say no. So for example, people who have diminished autonomy, children, let's say you want to research some rotavirus that affects children from the age 8 to 12, and it's very severe right now. You want to do that. if you go to a children and you say like, okay, children, I'm going to give you some medication for your RSV virus. You have to go to hospital 10 days, something like that. Children will never understand you because they are still young. They're still doing like 1 + 1, 2 + 2. They don't even know what a virus is, right? So they do not have the capacity to understand that. That means they don't have the capacity to make a voluntary or correct decision. Their autonomy is diminished. So the protection for the children is that we will require the parent or a legal guardian to be the one who gives the consent. We call it assent. So it's sort of like giving consent on behalf of the children. Because eventually the mother, father, or the legal guardian are the ones that understands the children the most, are the ones that know the benefits, know the risk the most, and they can sort of like calculate or weigh out the risk and benefit in that case. So that is one of the examples of like diminished autonomy. If you look at the case number 4, I think, no, case number 4 is not quite clear. Case number, no, the case study of like Tuskegee, for example. So in the Tuskegee, people did not know what's going on, right? Because they were like marginalized people. They were not fully US citizens back then. So whatever comes to them, they like, yes, good, better than nothing. They don't have full autonomy over their understanding. So they just had to say yes to anything that they get. So they did not have any additional protection. And the most bad part is when penicillin came out. Actually, I personally believe that there has to be some people in the Black community know about penicillin back then, but they were too afraid to request anything because they were like different in right in social levels. So they did not have full autonomy on that. So it is the job of the researchers that need to identify these vulnerabilities and also demonstrate, like Ajahn Sivaporn said, you have to demonstrate how you will protect them if they're vulnerable. You have to demonstrate how you will treat them or compensate them if a risk comes up like that. Okay, yeah. So I think that should answer your question. Well, the case about ethics is because there are many types of research. In medicine, there's like drug research, cosmetic research, exercise research, surgery research, like so many types. In social science, there's a lot of types too. There's, which one should I say? I'm not quite sure. Psychology research, competency with like language and stuff, conflict research. So there are many contexts, many aspects, but eventually we will try to use these principles. The Belmont is the first one that we use: respect for person, beneficence, and justice. And most of the time we try to look at the risks and benefits to see whether that research is like well balanced or not. Because we're in like year 2020, we don't want anything like this to be happening again. So it's also a job of the researchers, like, okay, we're going to do something good out of our research. So we have to like make sure that, yeah, we will not do any harm. There might be some risk going on, but not too much. Okay. Okay. I think that'll be all from my presentation for today.
Thank you, Dr. Chakree, and I hope that your throat will get well very soon.
Yes,
And
I have a doctor appointment like at 3, so I'm gonna go now.
everyone may need some break to energize our part, right? So we're gonna take about 10-minute break, and we will come back here at 2:30. Okay, please enjoy your break.
Thank you.
Okay. See you guys later at the easy office.
Take care. Bye.
Bye.
Okay, welcome back, everyone. Can you guys see my slide in full screen? And can you hear me clearly? Okay, thank you for your response. I am Sivaporn, and I serve as the secretary and a committee member of the MFU Ethics Committee, or I will call it EC from now on. And my primary role involves overseeing the ethical review process of the research protocol that submit to the MFU EC. As I saw from your account, I think that most of you are the first year postgrad student, right? And maybe
Yes, true.
okay, and maybe someone maybe the second year postgrad student. Have anyone ever submit your own protocol to the MFU EC? Or you are planning your research project now? I think that you are in the process of planning of your research project, right? So I think that today is the good chance to introduce about the investigator responsibility and as well as the involved document that you need to prepare to submit your protocol to MFU EC. And sorry, I can this way. This is my outline for my presentation today. It is about the investigator responsibility, both before approval and after approval from the EC. We will start with the investigator responsibility at before approval. And as you know that in doing a research, the investigator play an important role in the conduct of clinical trial, and their primary responsibility include protecting the rights, safety, and welfare of the research participant, and ensure that your study are ethically sound and scientific valid. And we need that all the research should adhere to the ethical guideline. And adhering to the established guideline is the first step to prepare a clinical trial or trial in human. The standard guideline that used by investigator is the ICS-GCP, or the guideline for good clinical practice, particularly outlined in the guideline 4. There are 13 subtopics in this guideline, and particularly the first 4 topic is about the investigator responsibility at before the approval. So by following this guideline, we can uphold the standard of ethical research and ensure the safety and well-being of our participants. We will start with the first topic. The first topic from the guideline is about the investigator qualification and agreement. Before starting a research project, the first thing to consider is the qualification of the investigator. The investigator must be qualified by education, training, and also experience to assume the responsibility for the proper conduct of the trial. It is essential that all researchers in the team should provide evidence of their qualification through the up-to-date CV, which have all members signed and dated, and also the relevant document as requested by the ethics committee that should be the certificate of EC training or the GCP training. Additionally, the investigator and they should be familiar and comply with the good clinical practice or GCP. This ensures that the study is conducted ethically and adhere to the standard guideline. And the last one, the investigator and their institution must permit the monitoring and auditing by the sponsor or the other regulatory authority, including EC as well. This process are crucial for maintaining the transparency and the overall integrity of your research. The second topic is about the investigator should have adequate resource. The first one is that the investigator should ensure their potential for recruiting the required number of the subject. They should be able to demonstrate, maybe based on the retrospective data, a potential for recruiting the required number of the subject within the recruitment period. And also the investigator must have sufficient time to conduct and complete the trial within the agreed trial period. So this, the effective time management is essential to ensure that all aspects of the trial are properly carried out. So to facilitate this topic, our EC form need the researcher to indicate the timeline of your research protocol in the form APO2 that I will mention later. So this clear schedule for all trial activity will ensure that your study is staying on track. Furthermore, the research investigator should have adequate number of qualified staff and also adequate number of facility available for the duration of your trial. And this including that the staff in the research team is well trained and all people who are assisting with the trial are informed about the protocol and also the investigational product and their duty and the function in your research. The next topic is about the medical care of the trial subject. To ensuring the well-being of the trial subject is the great responsibility of the investigator. Adequate medical care must be provided to all subjects for any adverse event related to the trial. This means that if a participant experiences any adverse reaction or side effect from your research, the investigator is responsible for ensuring that the participant will receive appropriate medical attention. And additionally, it is crucial to inform subject when medical care is needed for any intercurrent illness that arise during the trial. The intercurrent illness are health conditions that occur during the course of the trial, but they may be not necessarily related to the investigational product. So the subject must be advised to seek medical care for this condition to prevent complication and ensure the overall health and well-being. And the last one is that it is essential to inform the subject, primary physician, about their participate in your trial. The effective communication between the investigator and the physician of your participant will help maintain the continuity of care and also can help address any health issue that may arise during the trial. The first topic is that the communication with Institutional Ethics Committee or EC. Before initiating a trial, the investigator should have written and dated approval from EC. So in the EC submission form, you have to indicate the day that you will start your trial with the participant. And if EC detect that your trial is already started, we will not review the protocol. So before you start your trial, your protocol must be reviewed and approved by the EC first. And during your trial, if there any updating during the investigation, the researcher should provide the EC with a current copy of all documents that have amended. Also, during the trial, the investigator should provide to EC all documents subject to review until the closure of your research. So this is the fourth basic topic about before the approval from EC. And now we will focus on how to effectively prepare for the initial review by EC. To submit your research protocol to MFUEC, you have to prepare the related document as shown in this slide. Here is a detail of the list of the document. The first one is the AP01 form. We have subtype, subcategory of AP01 is that AP011 is the submission form for ethical review, and AP012 is the document of declaration of conflict of interest, and AP013 if the principal investigator is a student that that you are all student, right? So you must also submit AP013. This is the letter from your research advisor for the student project. And the next document is the AP02. The AP02 is the research protocol form. And along with this form, you should include any attachment that will be used in your study, such as the case report form, questionnaire, or your advertisement poster for recruit the participant. And every single document that you plan to use in your research, you should attach with the AP02 document. The next one is AP03 form. This is the very important document because it is the information sheet and informed consent form. We use this document with our potential participant to inform about the information and to get the consent from the participant. And if your research involve the specific participant group, such as children or cadaver or biospecimen, or your research is study about the genetic study, you must submit the relevant form, maybe AP032 to maybe AP036 in addition. All investigators are required to submit the CV with it up to date and also sign and date. This is including your advisor as well. And the last one, you should include the certificates of training in human research protection, and together with the good clinical practice to ensure that all certificates are signed and dated. And all AP forms can be accessed on the MFUEC website as the link shown below. As we discussed about the ethical aspect of the research, it is essential to focus on the concept of valid consent. For the consent to be valid, it must comply with three fundamental components that are the information. The first one is information. The participant must be provided with all relevant information about your research. This includes a clear explanation of the research objectives, procedure, and potential risks and benefits, and other details that might influence their decision to participate to your research or not. The next one is that the comprehensive, because it is not enough for participants to receive only information, but they must also comprehend it. This means that the information in the information sheet should be presented in a way that understandable to a participant. So if your research involves children, the language used in the informed consent document should be the language that understandable for children, right? So you should consider the background and the potential literacy level of your potential participant. And the last one is the voluntariness. The consent must be given voluntarily without any form of coercion or undue influence. So participants can be free to decide whether or not to participate to your study without being subject to any form of manipulation. And they also have the right to withdraw from your research whenever they want to withdraw without facing any negative consequence. So the information sheet and informed consent must be including all of these aspects. And the consent form used must be the one version that's stamped and approved by the ethics committee to ensure that all the information or the detail that appear in the document meet the standard. And don't forget that the subject or the subject legally acceptable representative in order you do the study in children should receive a copy of the signed and dated written informed consent form and any written information provided to the subject. This means that when you obtain the informed consent from your participant, you must be copy this document and give a copy to your participant or to the parent of the children if your research do in the children. And in the review process of MFUEC, it is essential for investigator to disclose any potential conflict of interest. This is done by using the form AP012, which must be submitted as a part of the initial review process. A conflict of interest arises when the circumstance creates a risk that an investigator professional judgment or action regarding the primary interest of the research that usually researchers do the research to generate the new knowledge, right? But when the purpose of the researcher is maybe deviated, the researcher may do the research for the other interests such as the scientific recognition or the financial gain. We call this situation that the conflict of interest. So when there are the conflict of interest, the conflict of interest may affect this item that consists of maybe professional judgment or maybe affect your research integrity, and also the COI can affect the ethical review as well. To be honest, as I work as a secretary of the EC committee, we usually receive a box of gift or a box of snack attached with the research protocol document. But to be honest, it help to sugary energize us very much, but I promise you all that I will treat you all fairly and equally. So this is the is called conflict of interest as well. So these may affect the scientific validity of the research and also may affect the right or the welfare of the participant. So how to manage COI? If there is any COI, the first one is that the awareness of COI. The researcher and also the ethics committee should aware about the COI and should have the strategy to manage the COI. Actually, in the EC process, the reviewer must be independent of the research team and any other COI that may affect the review process. And the second one is that to disclose the potential conflict of interest transparently. The researcher will to help ensure that the research is focused remain on the generating valid and unbiased knowledge, and to protect our participants to be well-being. And it is important to disclose any COI to the research participant. And during the time of informed consent discussion, the researcher should inform the participant about any relevant conflict of interest in both discussion and in the document. And to minimize the impact of COI, the EC may require that the member of the study team who has no leading role in the design of the research to be responsible for obtain informed consent from the participant. And in case of if the researcher have a serious conflict of interest, the involvement in the study may be restricted, and they may only participate as a consultant for specific tasks rather than being directly involved in the process of informed consent process. During the initial review process, once the investigator submit the research protocol along with all related documents, all documents from the researcher will be checked to ensure the quality of the document and also the completeness of the submission. All documents will be checked for completeness, correctness, clear information, consistency among documents, and also format and typo. All the document that does not pass this quality check will return to the investigator to be correct them and send it back again to MFUEC. So this is the first step. And once the quality check is complete, the research proposal and associated documents are processed through one of 3 review types based on the specific criteria used to evaluate the potential risk of the study. The research proposal that present more than minimal risk to human subjects will undergo a full board review. The full board review typically take not more than 57 working days to provide the first response from the EC to the investigator. That's almost 2 months. And the research procedure that present no more than minimal harm to the participant will undergo expedited review. And the expedited review usually take about 17 days to deliver feedback from the EC. And the last one, the proposal that involve research with no possibility of harm to participants are classified for an exempt review. The exempt proposal will receive feedback from the EC within 10 working days. So if you know that you will do the research that maybe pose more than minimal risk to the participant, you have to reserve your time for the EC process about 2 months. And this is the ethical basis for decision making in EC committee. So the EC should aware the special problem in research that may be involved with the subject, and the item that we check, including of A and I, is that appropriate or inappropriate. The first item is that the submitted protocol have a risk, but the risk to subject are reasonable in relation to anticipated benefit. As Dr.Chakree mentioned before, will be the risk and benefit ratio. And the second one is that the risk to subject are minimized. The third one is that the selection of subject is equitable, and informed consent will be sought from each prospective subject, such as for children participants, the informed consent should be suitable for children. And informed consent will be appropriately documented or appropriately waived. In some case, informed consent may be waived, but we have a standard criteria that this informed consent can be waived or not. And the next one is the strategy to protect the privacy of the subject and maintain confidentiality of the data. And the last one is that the additional safeguard to protect vulnerable subject. All of these items should be shown in your document, or in other words, your document, your proposal should have enough information for EC to consider and to making decision from your information. And once when your protocol is approved, there are some investigator responsibility after approval. The first one is that after the approval of protocol, the investigator should conduct the trial in compliance with the approved protocol. And also, the investigator should submit the report that involved with your research process. This including of the progress report and renewal of approval. The second one is the amendment report, SAE report, and protocol deviation report. And the last one is the closure report. All of these forms can be downloaded at the EC website. The first one is the progress report and the renewal of approval. The investigator should submit the written summary of the trial to the EC annually. For this is for the 1-year approval that most of the protocol that the risk is not severely high, usually approved for 1 year. So within 1 year of approval, the investigator should submit the summary or the progress report to the EC or according to the period that's specified by the EC. The submission of the progress report should be submitted before the expiration of the approval. And during the time of approval, if your study is still in process, the renewal of approval is required. So this is the example of the progress report and renew process. So for this is the example timeline of the progress report and renewal of the approval. Sorry. Okay, this is the example. If the protocol was approved on the February 1st of this year, the expiration date will be the January. Sorry, I can find my mouse cursor. Okay. The expiration date will be January 31 of the following year. Is that the next year? Assuming a 1-year approval period. And the progress report or renewal report should be submitted during the January of the following years, according to the EC requirement. So the report should be submitted within 30 days before the expiration date. So you can submit your progress report and or renewal form during the 1st to the 30th of January of the following year. And if the report submitted before the expiration date, the new approval will be on the anniversary date. That is the 1st February of the following years. But if the report submitted after the expiration date, the new approval will be on the new date that approved in the EC full board meeting. So it is possible that there may be a gap between the approval and during the gap of expiration, the researcher should not conduct the trial without the renewal. The second one is that the protocol amendment report. After the approval, if there is any change to the approved protocol, it is important that the investigator should report this change to the EC. The change can affect the conduct of the trial and may increase the risk to the subject, so it needs to be reviewed by the EC before proceed your research. If the change is considered minor, for example, the change in administration system or the change of information in document that does not increase the risk, or the change about the correct typo error, or any change that considered as a minor change and not pose any risk to the participant, this minor change will undergo a expedited review process. This ensures that the minor adjustment can be quickly assessed and approved by the EC. But if your change in protocol is deemed to increase any risk to the subject, it will consider as a major change. So the major change needs a full board review to thoroughly evaluate the potential risk and ensure that the continued safety will be applied to all participants. The next one is the safety reporting. The investigator should report any unfavorable medical occurrence in a participant during your trial, and whether the event considered related to the participation to the research or not. And the report should be submitted to EC in the required time frame. I mean that if the adverse events that arise during your trial is considered as the serious adverse events that are death or life-threatening or hospitalization of the participant, or the event that cause disability or permanent damage to any organ or any system of your participant, this is considered as the serious adverse events that should be reported immediately or within 24 hours after the notification to the researcher. And the other adverse event that may not serious, such as the change in health, including abnormal laboratory finding or something, this should be reported within the 7 calendar days to EC. And the next one is the protocol deviation, violation, and non-compliant report. The protocol non-compliant is any deviation from GCP and or from the protocol that approved by the EC. So if there is any deviation in your research, the investigator should submit the report to the EC after perceiving the deviation, actually as soon as the researcher received the deviation. So what is the protocol deviation? The protocol deviation in Thai is เบี่ยงเบน การเบี่ยงเบน or deviation is a departure from the approved protocols that made with or without prior EC approval. And this protocol deviation may not increase the risk or decrease the benefit of participants. For the example is that maybe subject cannot complete scheduled research activity or the study visit date being outside the window defined in the protocol, or the copy of signed document is not given to the subject. This example not increase the risk or decrease the benefit to subject, so we call this protocol deviation. And the next type is the protocol violation. In Thai is ฝ่าฝืน การฝ่าฝืน or protocol violation is the serious non-compliance with EC approved procedure that may increase the risk or may decrease the benefit of the participant that may affect the subject right, safety or welfare, and also the may affect the integrity of the research data. So the important point is that the protocol violation may increase the risk to the participant. For the example is to not obtain the valid informed consent from the participant, not following the inclusion or exclusion criteria, or the accidentally distribution of incorrect medication or dose or medication in the trial. This example can increase the risk and as well as may decrease the benefit to the participants. So we consider these are the protocol violation. And the last one, I think that every researcher very happy to send this report to the EC because the last one is the closer report. When complete the trial, it is the investigator responsibility to ensure the proper communication and reporting the closer report to the EC. A summary of the trial outcome must be provided to the EC, including the key finding and any significant observation and also overall conclusion from the study. And it is important to inform that all types of approved protocol all types including exemption, expedited, and forward review are required to submit the final report to the EC. But if your research is premature terminated, the investigator should provide the EC about the early termination of the research, and also you should provide a detailed written explanation of the termination or the suspension of your research, including of the reason of study termination and also the treatment, the follow-up, or the compensation process for the recruit subject after the termination of the study. And you should provide a strategy to inform the recruit subject about this termination. So this is about the care of the participant that you recruit in your research. So I think this is that's all for my presentation today. And I would like to welcome the question from the audience. Any question from the audience? So I think that in really soon, everyone must submit your research protocol to the MFU EC, right? So any concerning about the EC process or any concern about the preparation of your document? We have a lot of time left, so you can type your question in the chat box as well.
I ask one question from here.
Yes, please.
Yes. So I think all of these steps and procedures are quite clear for us now. I think it's quite clear, but yeah, upon the process, there will be some challenges and issues. So yeah, so we will, the challenges may rise at a later stage. But for me, the one thing I have been unclear about it is the research proposal. We have to start it parallelly with our study or somehow around the second semester of the first year.
I'm not sure about the timeline of your school,
Okay.
but I think that if you plan to do the research, I'm not sure, maybe your second year of the study, right?
Yes, I guess, yes, because when I see the timeline before, I was a little bit quite alarmed about the timing. So yeah.
So it usually depend on the type of your research. And from my experience, most of the protocol from the School of Anti-Aging, you are in the School of Anti-Aging, right?
I'm from social innovation.
Social innovation. I'm sorry, this is the timeline of the EC submission is depend on the level of the risk of your proposal. So I recommend that you should think about the time frame of the EC process as I'm show in my slide. Just a minute.
Yes.
Sorry. Can you see my slide now?
Yes, it's still moving.
So we have time frame for the
Yeah,
initial
that one.
of the protocol. So if your research is considered to propose more than minimal risk, that will be reviewed, maybe reviewed in the expedited or the full board review. So you have to reserve the time for the EC process before you start to collect or to approach your potential participant. So I'm not sure that when I'm not sure because it depends on your curriculum and your school, right? So my recommendation is that you should consider about the time frame of the EC review before you start to approach your participant or before you start to collecting the data from your participant. For example, if you want to do some experimental study in the participation, experimental study, I mean that have some experiment on the human. And if your study product is non-invasive, is just about the interview or something that not do any harm or physically harm to the participant, your research may consider as the expedited. So it will take about 2 or 3 weeks to review by the EC. So you need to reserve the time before you start the collection data from your participant. So if you want to do the research in the second semester, you should submit your protocol to EC during the first semester.
Okay.
But if the research protocol or anyone that plan to do the research that pose not more than minimal risk or pose no risk to the participant, such as the education study, the study in the classroom, or something that about the taste the taste of the food or the smell of the perfume that you develop, it is may be considered as the exemption that take only 10 days of the review. That so my point is that the duration is depend on the risk of your study. So you have to well plan about your timeline to do the research and to get the EC approval before getting the information before approaching your research participants. So I'm not sure that my answer is clear.
Thank you. No, thank you. It's clear now.
Thank you for your question. And any questions?
Thank you.
So actually, I think that for the postgrad student, most of postgrad students are in the School of Anti-Aging, that almost all of protocol from the school is the experimental research that usually propose more than minimal risk to the participant. So almost most of them goes to the full board review. So you actually need about 2 months, at least 2 months before you plan to start your research in the participant. So this is depend on the level of the risk and also the benefit that will propose to the research participant. This point, I recommend that you should clearly discuss with the research advisor before submission of document to the EC. And I know that there are a lot of detail about the document that you need to prepare to submit to the EC, right? As I mentioned in this slide, we need a lot of document for the review process. For the MFU EC secretary team, we have a special service for the student, for the MFU student. If actually for the undergrad student, they usually do the research in the third semester, right? In the third year, starting from the second semester of the third year. So during that time, the school can invite the EC team to give some advice for individual student protocol in the process of developing the document for EC submission. So if you have any question about the preparation of individual document, you can together as a group and invite us to teach you how to prepare the document to specifically match with your study protocol. ก็อันนี้เดี๋ยวขออนุญาตเป็นภาษาไทยนะคะ ก็คือจะขออนุญาตประชาสัมพันธ์นะคะว่าทีม EC ของเราเองเนี่ยเรายินดีที่จะไปเหมือนกับว่าโรดโชว์ให้ตามสำนักนะคะ สมมุติว่าสำนักไหนแพลนจะทำซึ่งเราไม่รู้รายละเอียดของแต่ละสำนักเนาะว่าแต่ละสำนักเนี่ยกำหนดให้ทำในช่วงชั้นปีไหนเทอมอะไรอย่างเงี้ยค่ะแต่ว่าถ้าสมมติว่าสำนักนี้มีไทม์ไลน์ที่ชัดเจนว่าจะต้องทำงานวิจัยในเทอมนี้และก็จะต้องขอapprove จาก EC ก่อนหน้าในช่วงระยะเวลาที่มีการเตรียมเอกสารสำหรับส่งให้ EC พิจารณาเนี่ยก็คือแต่ละสำนักสามารถเชิญเจ้าหน้าที่แล้วก็ทีมเลขาจาก EC นะคะเพื่อไปช่วยในการแนะนำการเตรียมเอกสารทั้งหมดแล้วก็เพราะว่าบางเรื่องเนี่ยมันมีรายละเอียดที่แตกต่างกันในแต่ละ Research Protocol ซึ่งเราก็จะได้ช่วยอธิบายให้เป็น specific ไปเลยของแต่ละคนนะคะก็เราก็จะได้ช่วยในการแนะนำว่าต้องเตรียมเอกสารอะไรเพิ่มเติมบ้างอะไรอย่างนี้นะรายละเอียดตรงไหนยังไม่ครบอะไรแบบเนี้ยค่ะก็คือ EC จะสามารถเข้าไปช่วยในการเตรียมเอกสารก่อนที่จะ submit จริงๆก็น่าจะช่วยให้กระบวนการพิจารณาเนี่ยเป็นไปได้อย่างรวดเร็วแล้วก็การแก้ไขก็จะน้อยลงด้วยหลังจากการพิจารณาจากกรรมการค่ะก็ช่วงไหนถ้าสำนักไหนจะทำงานวิจัยแล้วก็ส่งหนังสือเชิญมาได้นะคะเราก็ยินดีไปหาทุกสำนักเลยออนไลน์ก็ได้ออนไซต์ก็ได้ค่ะเดี๋ยวขอดูคำถามในแชทบ็อกซ์ก่อนนะคะ For the first question in the chat box, the question is that in the field of linguistics, which type of acceptance is typically approved by the committee, exemption or expedited? I cannot clearly answer this question because there is a lot of detail in the research. The main point is that your research protocol propose how much risk to the participant because some study only from the document that have no individual data of someone that maybe pose not more than minimal risk and or maybe no risk that will be approved as not approved that will be reviewed as the exemption but in the some linguistic research that have to interview maybe interview or do the questionnaire in the participant this may not be the exempt review this may be expedited review but usually the field of linguistics I think that half about exemption and expedited so we need to consider about your research tools as well and about the invasive level how much you invade the personal data of the participant as well so I think that in the first question I think that half about exemption or expedited review. Okay, thank you. And the next question, when subject or volunteer feel adverse effect As a result, they do not adhere to the rule or the guideline outlined in the consent form. Do the researcher or investigator need to proceed with reporting? Shall we withdraw? Oh, yes. The first question, if the volunteer do not adhere to the information that described in the consent form, right? Do the research need to proceed with reporting? Yes, we need that the investigator should report, no, not should, must report to the EC, but you can provide your explanation about the adverse events. Okay, you can provide your explanation about the adverse event that arise with that participant, why they have adverse event. And I know that we know that adverse event can arise. No one wants adverse event, right? But if it arise, you just report to the EC, and we will see that how you take care of this participant, why you do that. So we not judge that this is correct or this is incorrect, but I think that we just want some information about how you treat the participant with the adverse event. And if it is not proper, EC just give some advice to the research, but we don't do anything harm to the researcher. So please send the reporting, even if you think that it is not the fault of the investigator. So shall we withdraw the subject in that case? In every research protocol, we require that the investigator must indicate the withdrawal criteria in the protocol. In the AP02 form, we have one topic, that is the withdrawal criteria. So you have to list that 1, 2, 3, 4, 5. If they have one of these criteria, we will withdraw these participants out of the research. So shall we withdraw the subject in that case? Is it depend on that you indicate this criteria on your protocol or not? If you indicate specifically that the participant who not adhere or who cannot meet the suggestion of the researcher will be withdrawn from the research, that yes, you can withdraw the participant from your research, but you have to indicate some post-trial care or post-withdrawal care to those participants as well. And the next question, forward thesis work, do we need to work alone? For this question, do we need to work alone, or can we produce it together with the same major student? I cannot answer this question because it is the individual criteria of your major. So I'm sorry that I cannot help you for this question. I think that you maybe discuss with your advisor to find out that can you work with your college or not. Sorry that ค่ะไม่เป็นไรขอบคุณค่ะ I'm sorry, but usually I'm for the undergrad, and from my experience, for undergrad student, they can work together as a group of researcher, but in postgraduate student, I'm almost 100% I see that there are only one student and maybe some assistant or one advisor and one co-advisor that I usually see in the EC office. do we have to submit the application and stuff in paper? You mean paper, right? Okay. Yes. From now, for in the present, we are developing a e-submission system, but it is not finished yet. So we still require everyone to send a hard copy of all documents. So we indicate the number of hard copy that we require in the website of EC. When you prepare your document, you go to the website of ECMFU and there will be a table that show that how many copy of the document that you need to submit. I think that now we still need 4 copy in paper for each document, because just in case for the full board review, we need to send 3 hard copy to 3 reviewers. So we still need hard copy because some reviewer require the paper of the protocol because there is a lot of information per one research protocol. So some reviewer is more comfortable to read from the paper. So we need at least 4 copy of document to submit to EC office. And actually, I am like all researcher in MFU. I'm just can't wait for the e-submission system to be complete because I'm so I'm so sick of paper in our office. There are a lot of paper in our office. So any question about the preparation of the protocol? So now in the EC office, we have 3 staff that will take care of your protocol. So if you have any question, you can contact our staff through the email of the ECMFU, and they will happy to help you all. Our staff is so kind. So any question? So no more question. Okay, เชิญค่ะ please.
Sorry, just only a minor question. Is there a physical office, or can I know the building and room number?
Yes, our office is on the AS building, or do you know AS Academic Service building?
Yes,
the-
yes, we know it. Yeah.
Yes, our office is on the 4th floor. When you go out the elevator, you turn on the right and then turn on the right again. Our office is beautifully placed at that building. You can knock at the window, and there are our staff sit there.
Thank you for the information.
Hello.
Thank you.
So we are welcome you all to visit us both through email or through the physical office. We have space for the investigator to prepare your document as well at the office. So I think that this is maybe all for today. And as a secretary of the EC office, I'm looking forward to receive a good research protocol from your all. And please don't hesitate to contact us if you have any problem about the EC submission. And yes, again, I very happy if you invite our team to your school to sharing about our protocol and our working process. And this is my email. You also can email me using this email. We can check the certificate via website, right? You mean that if you have approved by EC, can you check the certificate? Can you check the certificate of approval via the website, right? Or which certificate that you mean? Sorry. For the ethical seminar, you mean the certificate of training or something? Ethical training, right?
Yes, because in the previous session, we were told that attending this session will allow us some training certificate or something like the attendance or something like that, so we can use later in our research proposal or preparation process.
I'm not sure that this session will provide a certificate for you or not. But I personally recommend that in our MFUEC website, we also have the e-learning session as well. You can go to our MFUEC website and take a brief course at the website, and you will get the certificate of training that can use in the submission process of MFUEC. So a lot of students use the training certificate from our website. But I see the link that our staff provide for you all for the satisfaction assessment. So please access the link and do it. But actually we receive all of the certificate of training from whatever institution. The popular institution is that the Thammasat University and the city is also accept, and also from the MFU EC is well accept for EC review process. This is free online course. So any other question? So
Excuse me, can I have a word, please?
yes.
This research ethics training is only a condition that must pass to be able to take the proposal exam only, and there is no training certificate for that. And also, this research ethic will not apply for the human research ethics as well. Thank you.
Sorry, please repeat again, please.
I mean, this research ethics training is only a condition that must pass to be able to take the proposal exam. And there is no training certificate for this.
Oh, okay.
Yes.
Okay, thank you for the information. It is clearly that this training is essential for the proposal examination, but they did not provide any certificate for you all to submit with the research protocol. Once if you want to submit your research protocol to EC review process, you must have the other certificate. As I recommended that you can use, you can learn from the e-learning system from our MFU EC website and attach attach it with your research protocol. Okay, thank you for your information. And if there is any other question, I think it's about the time. And I would like to thank you, everyone. Thank you for your kind participation for this class. And I hope that everyone can do the research ethically and scientifically in the future. So thank you and goodbye, everyone.
Thank you for your time. Bye.
Special thanks to Assistant Professor Dr. Sivaporn Sivasinprasasn and Dr. Chakree Wattanasiri for being with us today and give us your insightful presentation. And before the activity ends, I also want to thank you all of your for your participation, and I hope this training was very helpful for you to do your research. And thank you, and we look forward to seeing you at future events. Have a great day.